Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Hyaloid vasculature. So what is hyaloid vasculature? So in the hyaloid vasculature, actually there are hyaloid vessels are present. Okay, where are these hyaloid vessels present? These hyaloid vessels are present from the optic disc through the they are present from the optic disc through the vitreous humor. They will reach to the lens. Hyaloid vessels are present from the optic disc through the vitreous humor and they reach to the lens. They are actually present in the intrauterine life and they start regressing by 4 months of age and they completely disappears by 8 months. So if we see the picture, right, so this is the hyaloid artery. This hyaloid artery is present in the lens. From the lens it starts, and if you see the histological picture of the hyaloid artery, so this is the hyaloid artery which goes from the posterior surface of the lens to the retina. So that is optic disc. So it starts from the optic disc through the vitreous it goes and it attaches to the posterior surface of the lens. So it actually regresses by 4 months of age and it completely disappears by 8 months.
thank you and thank you for watching.